You're good whenever.
Hi, I'm Zach Nunn, State Senator for Sitting District 15, and I'm here with Mary Neubauer of Clive. We're talking a little bit about today mental health. So one of the challenges that we've been faced for over 20 years in Iowa is that we don't have a real mental health system for children. And just this week, we passed a mental health bill that speaks specifically to children in Iowa. I'm going to talk about the scope, and then I'm going to have Mary kind of share with us her experiences and some real personal story here. 64,000 Iowan children do not have a place to go when they are in their time of crisis or need. It impacts children of all socioeconomic backgrounds and all need. Even those families who have the ability to pay don't have an inlet into the system. There's no on-ramp for them. And the additional challenge is that once a child is identified, maybe by a school nurse, maybe by a family member or a doctor, they don't have the ability to get the resources they need. This process now changes, and the governor's been a great leader in this. Yeah. Mary, share us the story of you and Larry's experience with this.
Sure. You know, and you and I have worked on legislation for a couple of years now. Last year we worked on legislation to provide additional suicide prevention training for teachers, which is another huge component of this. But, you know, Larry and I kind of burst onto the scene, for lack of a better word, when our son Sergey tragically died by suicide in September of 2017. And you are exactly right when you said even those families that can't afford it just can't find help here in Iowa. And we were desperately searching for, you know, a residential program where Sergey could go, because the type of help that he was getting just wasn't enough support for him. And there just wasn't any here in Iowa. And we would ask the doctors and the nurses, you know, where can he go? Where could he go to get help? And they would just say, I don't know. And Zach, I can't tell you, when you're the family member, you see your child desperately ill and struggling, and the doctors and the nurses say, I don't know. You know, that wouldn't happen with other types of healthcare situations. And so that just told us, you know, this has to change. And so ever since Sergey's death, we've been working really hard to bring about that change here in Iowa, because we know it's too late for our story, but there are thousands of other Sergeys all across the state, just like you said. And if we can save them that heartache, that's what we want to do.
Right. So Mary, compliments to you, compliments to the governor. I think that there's been a number of mental health care providers across the state, a number of educators, and certainly an overwhelming number of families who have come forward, who have given recommendations, and now the state has actually moved a bill through both the House and the Senate. It looks like it's ready for the governor's signature, and this will build on the system that we have, as I understand, but then also afford something that is tailored specifically for children.
Right. You know, Iowa has mental health regions on the adult side, and basically children's mental health care will be added into those regions. There's already an existing system. Why create a brand new one, right? Absolutely. But you're exactly right. We will begin to build programs and help specifically tailored to kids. And to think that this has never existed before in Iowa, this really is your...
As a parent, but both as a spokesperson for this, as you highlight, is the first step. And there will be more to come, but we're very grateful.